The prostate is often called a man's second heart, for a reason. This small organ plays an incredibly important role in men's health. The prostate, or prostate gland, is about the size of a walnut. It's located just below the bladder, tightly surrounding the upper part of the urethra, the tube through which men urinate. Because of this location, any changes in the prostate can affect urination. As a doctor, I often hear the joking question, is that the thing that starts ruining your life after 50? Indeed, prostate problems often affect older men, but it begins working for your benefit from a young age. Many of my patients know little about this organ until they experience discomfort. Though the prostate is small, its importance is massive. This gland is crucial to male reproductive health. A healthy prostate produces seminal fluid, the main component of semen, that nourishes and protects sperm. This fluid helps sperm stay active and viable. The prostate also influences hormonal balance and plays a key role in sexual function. When your prostate is in good shape, you likely have normal sexual performance and no discomfort during intimacy. But once problems appear, both physical health and self-confidence suffer. The prostate starts to change as men age. Around 40 to 45, it often begins to enlarge. Some men hardly notice, while others experience real trouble. We'll cover that soon. But know this, a healthy prostate is not just about fertility, it's essential for sexual vitality and overall well-being. When it's working right, you don't even notice your prostate. But once trouble starts, it becomes very clear just how vital it is. In the next episode, we'll explore exactly what the prostate does, the functions it serves, and why keeping it healthy is so important. Despite its small size, the prostate serves several key roles. I often compare it to a tiny factory and valve rolled into one. Let's look at its main tasks. 1. Producing seminal fluid. This is the prostate's main role. It creates the fluid that mixes with sperm to form semen. This fluid contains nutrients and enzymes that support sperm health. In short, the prostate provides the fuel sperm need to survive and reach the egg. 2. Motor and valve function. The prostate has muscle fibers that help push semen out during ejaculation. At the same time, it acts as a valve, blocking off the bladder so that semen and urine don't mix. This keeps everything flowing in the right direction during sexual activity. 3. Hormonal interaction. The prostate also interacts with male hormones. Inside its tissues, testosterone is converted into its more active form, dihydrotestosterone, which stimulates the gland. This process helps maintain normal prostate function and indirectly affects sexual health. It still amazes me how nature designed this tiny organ with such complex and vital responsibilities. So, the prostate is not some passive part, it's an active controller of the male urinary and reproductive systems. When it all works in harmony, there's no reason for concern. But next, let's look at the health problems that can disturb this balance. Unfortunately, the prostate is a sensitive organ and vulnerable to various diseases. Most prostate issues fall into 3 categories: inflammation, prostatitis, benign enlargement, BPH, and cancer. Let's break each one down. Prostatitis. This is inflammation of the prostate. It can affect men of any age, but more commonly younger and middle-aged men. Causes include bacterial infection, cold exposure, sedentary lifestyle, irregular sex, and even chronic stress. Symptoms include burning or pain while urinating, frequent urges to pee, pelvic or lower back pain, and sometimes fever. While prostatitis is unpleasant, it's rarely life-threatening. But if untreated, it can become chronic and greatly reduce quality of life. Benign prostatic hyperplasia, BPH. After age 45 to 50, many men experience prostate enlargement. This is called BPH, or simply an enlarged prostate. Benign means it's not cancerous, the cells are growing, but not in a dangerous way. It usually stems from age-related hormone changes. An enlarged prostate presses against the urethra, making it harder to urinate. Symptoms include weak urine flow, frequent night urination, or feeling like the bladder doesn't fully empty. Over time, untreated BPH can lead to bladder or kidney problems. Prostate cancer. This is a malignant tumor that develops in the prostate tissue. It's most common in older men, 50 plus, and those with a family history. Unlike BPH, cancerous cells grow uncontrollably and can spread to other organs. The danger is that early-stage prostate cancer often has no symptoms. Later, it may cause similar signs to BPH or more serious ones like bone pain. The good news: early detection saves lives, as treatments are most effective in the early stages. These conditions vary in seriousness but can all be managed if caught early. In the next episode, I'll explain how to spot the symptoms and what tests help detect prostate problems in time. How do you know something's wrong with your prostate? Here are the most common warning signs. Urination issues. Difficulty starting urination, weak or interrupted urine stream, feeling like your bladder isn't fully empty. Frequent need to urinate, especially at night, more than 1 to 2 times. Burning or pain during urination. In some cases, blood in urine. Pain or discomfort. A dull ache or pressure in the lower abdomen, groin, or between the scrotum and anus. Pain may also radiate to the lower back. In acute inflammation, there may be fever and chills. Sexual changes. Weaker erections, painful ejaculation, premature ejaculation, or lower sex drive may signal prostate issues. Also watch for blood in semen. Other signs. Sometimes there are no symptoms at all, but a blood test, PSA, may show a rise in prostate-specific antigen. Fatigue or unexplained weight loss may occur in advanced cancer cases. If you notice any of these, don't wait, see a urologist. At the clinic, the doctor will ask about your symptoms and perform a physical exam. This often includes a quick digital rectal exam, DRE. It may feel awkward, but it's quick and gives vital info about the prostate size, texture, and tenderness. Diagnostic tools include PSA blood test. PSA levels rise in cases of prostatitis, BPH, or prostate cancer. This simple test is a key early warning tool. Ultrasound, transrectal or abdominal. Gives a clear image of the prostate size, shape, and possible abnormalities. Urinalysis. Detects signs of infection or inflammation. Prostate secretion or urine culture. Helps identify bacteria in infectious prostatitis. Biopsy. If cancer is suspected, a small sample is taken for lab testing. Modern diagnostics can detect prostate issues early. Timely testing means easier treatment. Next, I'll explain what treatments actually work for prostate conditions. The good news is that most prostate conditions can be successfully treated, especially when detected early. Modern medicine offers effective approaches for each type of issue. Let's explore how prostatitis, BPH, and prostate cancer are managed, and what actually works. Prostatitis. Treatment depends on the cause and severity. For acute bacterial prostatitis, antibiotics are the mainstay and must be taken as prescribed through the full course. Anti-inflammatory meds help relieve pain and reduce swelling. Increased fluid intake, avoiding alcohol and spicy foods, and rest are often recommended. For chronic prostatitis, non-bacterial, treatment might include warm sitz baths, prostate massage, as advised by a doctor, physical therapy, and pelvic exercises. The goal is to reduce inflammation and restore normal prostate function. With the right treatment, discomfort usually eases and urination improves. Early attention and avoiding self-treatment are key. Benign prostatic hyperplasia, BPH. Treatment depends on the severity of symptoms. In early stages, medications can be very effective. Doctors prescribe drugs that relax prostate and bladder muscles, improving urine flow, as well as medications that slow or shrink prostate growth. These may take several weeks or months to show full results. For many men, this helps avoid surgery. However, if the prostate is severely enlarged and medications are no longer effective, surgical options are considered. The most common procedure is transurethral resection of the prostate, TURP, where part of the gland is removed through the urethra. There are also newer, less invasive procedures. Proper treatment significantly improves quality of life by restoring normal urination and comfort. Prostate cancer. Treatment depends on the stage of cancer. If the tumor is confined to the prostate, the main options are surgery, removing the prostate, or radiation therapy. These can often completely eliminate early-stage cancer. If the cancer has spread, doctors may use hormone therapy to suppress testosterone, which fuels cancer growth, or chemotherapy in advanced cases. These treatments may not cure, but they can slow progression and improve life quality. Treatment plans are personalized based on age, health, and cancer stage. Early detection offers the best outcome. Let me give you one strong piece of advice: avoid falling for miracle cures or online remedies promising instant results. Many patients waste valuable time on ineffective solutions. What works is proven: early diagnosis, professional care, and adopting healthy habits. And speaking of habits, that's the focus of our next episode. Now to the most empowering part: prevention. In my experience, adopting a healthy lifestyle greatly reduces the risk of prostate problems. Here are the top habits that help protect your prostate. Balanced diet. Eat more vegetables, fruits, greens, and whole grains, plus lean proteins like fish and poultry. These are rich in fiber, antioxidants, and nutrients beneficial for the prostate. Tomatoes and pumpkin seeds are especially helpful. Cut back on red meat, saturated fats, sugar, and salt. Drink enough water, 1.5 to 2 liters a day, to flush the urinary system and reduce infection risk. Regular physical activity. Exercise improves circulation in the pelvic area, preventing stagnation. You don't have to be an athlete. Daily walking, stretching, or swimming is enough. If you have a desk job, take short breaks every hour to stand up and move. Staying active also helps with weight control, which is linked to prostate health. Proper sleep and rest. Chronic sleep deprivation weakens immunity and upsets hormones. Aim for 7 to 8 hours of sleep per night. Good rest supports hormonal balance and overall health. Stress reduction. Chronic stress affects the prostate via hormone shifts and immune suppression. It can trigger prostatitis flare-ups. Practice relaxation, walks, hobbies, meditation, or breathing exercises. A calm mind supports a healthy body. No bad habits. Smoking and excessive alcohol harm blood vessels and increase inflammation. Smoking impairs blood flow to the pelvis, while strong alcohol irritates the urinary tract. Quit smoking entirely and keep alcohol moderate. Safe, regular sex life. Regular ejaculation helps clear the prostate and prevent fluid buildup. It also lowers stress and improves blood flow. Safe sex with a consistent partner reduces risk of infections that can inflame the prostate. Personal hygiene and warmth. Keep good hygiene, regular showers, clean underwear, and proper grooming prevent infections. Avoid sitting on cold surfaces and dress appropriately. Prostate inflammation is often linked to exposure to cold. Don't hold in urine too long either. These habits are simple but powerful. They not only protect your prostate, they enhance your overall vitality. In our final episode, I'll leave you with a few closing thoughts and long-term prevention tips. I always remind my patients of this truth: it's easier to prevent disease than to treat it. That goes double for the prostate. After everything we've covered, here are my top long-term tips. Annual checkups. Don't wait for pain or symptoms. After age 45 to 50, visit a urologist yearly. These checkups should include a health discussion, a prostate exam, and possibly a PSA blood test. Early detection often means simple treatment and peace of mind. Listen to your body. Pay attention to changes, frequent night urination, pelvic discomfort, or reduced sexual function. Don't be shy, your doctor hears this every day. It's far better to get checked than to ignore something serious. Make prevention your routine. The lifestyle changes we discussed, healthy diet, exercise, rest, avoiding toxins, are daily choices that pay off in better health. I've seen men in their 70s and 80s with excellent prostate health, simply because they stayed consistent. Work with your doctor. Be honest and curious during appointments. If you've been diagnosed with a condition, follow your treatment plan, take meds as prescribed, and ask questions. Don't self-medicate with internet tips or pills from friends. Every prostate is unique, and your care should be too. Finally, don't fear the topic. Prostate issues are common but treatable. Whether it's inflammation, enlargement, or even cancer, there are solutions. Most men can stay healthy and active for decades with the right knowledge and habits. I hope this guide has helped you better understand and protect your prostate. Stay proactive, stay informed, and most of all, stay healthy.